So I found out I was having identical twins at 8 weeks. And as a physician in another field, I was already worried about having monochorionic diamniotic twins. I was worried about two diagnoses, in particular twin-twin transfusion and unequal placental share. But at 14 weeks, this worry became a reality for us. We found out on an ultrasound that our twins were different sizes. We had one twin that was about 30% larger than the other twin. And at this point in time, it wasn't clear whether I had twin-twin transfusion or unequal placental share. So we were monitored very closely over the next several weeks, and in the end, the diagnosis was unequal placental share, meaning our larger twin, Olivia, had approximately 70% of the placenta, and the smaller twin, Frances, had only 30% of the placenta. Each week was a different story for us. Each week we had another ultrasound to monitor the twins, and the things changed very rapidly. And so I know as a mom and as a physician what it feels like to be delivered the devastating news, the fear and the gut-wrenching worry that you have when someone tells you something is wrong with your unborn child. But I also know how important it is to have the leaders in the field, the experts in the field that are taking care of your babies. And I think any parent that finds out this diagnosis deserves that peace of mind during pregnancy to know that the experts are really taking care of them. I had weekly ultrasounds. So starting at 14 weeks, I had weekly ultrasounds with Dr. Goldstein, with Vicki Feldstein and the others. And we monitored for size, we monitored fluid, Dopplers, and growth, which are really important to assess the health of the pregnancy. And at that time, at 14 weeks, we didn't know that the diagnosis ultimately was just going to be unequal placental share, because often you can have a mixture of both twin-twin and unequal placental share. So we were monitoring closely for the fluid because this is going to affect the ultimate treatment options. So I had weekly ultrasounds, and the team at UCSF told us that the pregnancy was going to depend on how long our smaller twin continued to grow. And so when the smaller twin, when Frances stopped growing, when she reached the 10th percentile and started to dip below the 10th percentile, I started to have weekly non-stress tests, which is a test to assess the heart rhythms of the baby to decide whether they're reassuring or non-reassuring. And at about 30 weeks, Frances had a non-stress test that was non-reassuring. And at that time, it was decided that the best thing was to come into the hospital. And so I came into the hospital around 30 weeks and had 24-hour monitoring. And really, this was the toughest part of the pregnancy emotionally for me. I, was awake almost 24 hours a day because I didn't want the monitors to fall off. And the team at UCSF, from the medical students who were in the room with me that had the most incredible empathy, the time to sit down and talk, to the residents and fellows who were always very professional, to the attendings who are really, the world-class leaders in their field, but also the nurses. We had nurses that helped us and made sure that those monitors stayed on 24 hours a day and came in and checked us out, and it was really an experience that could have been a nightmare, and it still was very scary, but knowing that we had the best people taking care of us helped to give us, my husband and I, peace of mind. And I think what's important is not only the people that are able, the skills of the surgeons and the perinatologists for fetal treatment, but also the intellectual skills to know who needs treatment and who doesn't. And in my case, there were options early on because we didn't know whether I had twin-twin transfusion or unequal placental share. But in the end, just looking at my numbers and the growth of Frances and Olivia, my twins, it was decided that the best thing was really conservative treatment and early delivery once I made it past 28 weeks, because the fluid difference, Frances always had some fluid. She never got to the point where she didn't have any fluid around her, so we did not have treatment. So while we were in the hospital, Frances, the decelerations that she was having initially on the non-stress test started to last longer and longer. So when we first came in, I think on the second day, Frances had a heart rate deceleration for about 6 minutes. And really, they don't want the heart rate decelerations to go to 10 minutes because that would be an emergency C-section. So the heart rate cannot be down beyond 10 minutes. And so this, of course, just is a terrifying experience to watch your baby's heart rate fall. And this happened several times, but we were weighing the early delivery and the chance that the lungs may not be mature with the heart rate decelerations. Between the heart rate decelerations, there was normal beat-to-beat variability. And so at about 32 weeks, Frances had another heart rate deceleration that lasted up to 8 minutes, and they took me urgently to C-section. And at that time, Frances's lungs were mature. She was small. She was born at 2 pounds and 13 ounces. And Olivia, her older sister, was born at 4 pounds and 3 ounces. So they had about a 38% difference in weight. And it looked like about a 70% of the placenta truly was for Olivia and 30% was for Frances. And they spent 5 weeks in the NICU at that time. And again, we credit UCSF with saving our children. And now at home we have 2 healthy little girls. The NICU was a pretty amazing experience. I mean, in many different ways. The very first night when we had the girls, we found out that Olivia had a pneumothorax, which is basically a small hole in the lung, and her lung had collapsed. And they came in to tell us that not only that she had a pneumothorax, but that had put some pressure on the blood return to her heart. So she had what was called a tension pneumothorax. And they had to put her on pressors, medications to help her blood pressure stay. And she had multiple lines and tubes and a new chest tube in. And as a new mom, I was absolutely terrified. And I remember thinking, I've got to do something. And that first night, that's when, I started pumping and just trying to make milk and do something, anything that I could do. But the fellow that came in to tell us the news was amazing. He was calm. He had all the information for us. He had a NICU attending in-house, and they had basically done the procedure, and Olivia was stabilized and was doing fine, and he had an answer to all of my questions. And throughout the NICU experience, we were allowed to round with the team. We were allowed to ask questions. They were very open with us. They always wanted to encourage what's called skin-to-skin contact. So I was able to hold Frances, who was not on the ventilator, that very first night, even though she was 2 pounds and 13 ounces. And they were able to start trying to breastfeed in the first couple of days, although they were still really small and getting the majority of their nutrients through feeding tubes. And what was really impressive is that both girls had their own individual nurses in that first week until they were really more healthy and more robust. And the nurses were amazing. We used to call all night long. My husband and I would wake up at night when we were home and call to check on the girls. And there are even rooms in the NICU for parents to stay. So it's a really family-friendly NICU. I would say that you should go and find not only the people that you feel comfortable with, but the people that are the experts in the field, the people that are going to know what to do for your babies, the people that are going to take the best care of you, that have the knowledge, that have the answers to your questions, and also the people that are going to treat you like a person, like a human being, and understand the implications of what's going on for you. And that's UCSF. I mean, for every facet of our care, all of the ancillary staff, the sonographers, the nurses, the physicians, the medical students, they were all so empathetic, but also had the knowledge and the skills that they needed to really take care of us. And I think that package is what a parent deserves when you're in this situation, because you're scared, you're frightened, you can barely think clearly. You need someone to help carve out that path for you to bring your babies to you. So